Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our Hospital System General Director. Today is Thursday, November 4th, giving you the update from Albany Med. Fred, I did the math. This is our 1,754th video.
Is it really?
No. It just feels that
Seems
way.
like you got an extra zero on there.
Remember inside the Actors Studio, James
Yes.
Lipton with his stack of cards? That's
Yeah.
what we feel like today. We have a
That's
lot to
right.
cover.
We do.
Let's jump right in. First graph, New York State, people in the hospital with COVID. That number continues to be under 2,000.
That's right.
So 1,908 there. Here's the capital region number, and that number is 146. Now, I'm going to call it, Fred. On that graph, we were plateaued for a while. It really does now look like that's going down.
I think you're right, Dennis. We peaked around 180, and we have been drifting down now for the last week and a half, 2 weeks.
So we're cautiously optimistic that will continue
much
next
so.
week. Next graph is admissions and discharges here at the medical center. And the take-home point here is it's single digits. It's 3, it's 4, it's 5 a day.
That's right.
For the last week or so. So last graph as far as the COVID numbers here on this campus, let's pop that open. Here's the morning census at Albany Medical Center. We currently sit at 34. The breakdown there is 14 in the ICU and 6 of them are on ventilators. Fred, of those 34, 31 adults and 3 children.
That's right.
Of those 34, 10 no longer infectious. And in the last 7 days, again, that number's come down. So in the last 7 days, we admitted 15 and we discharged 19. And of the 15 we brought in, 2 of them had been vaccinated. So 13 of the 15 who got admitted in the last week, unvaccinated. Fred, we haven't talked about this in a while, but for those who are saying, what does that mean, no longer infectious? So 10 of them are no longer infectious. What does that mean?
That's right, Dennis. So they've come in, they were positive for COVID, they've had their illness sort of play out, and now they no longer are shedding virus,
Right.
so they can't infect someone else.
So why are they still in the hospital?
Well, they may have come in for something else, and they were COVID positive,
Okay.
and they've gotten better from COVID, but not their underlying issue. Or they may have gotten debilitated if they
Okay.
were really sick with COVID, and they're still working through some of the after effects.
All right.
But they're no longer able to infect anyone else.
Let's take a look at a couple other numbers. Fred, you introduced these graphs a couple weeks ago. This looks at the period of time over the last 6 months from April 24th to October 23rd, and the vertical bars represent the different strains of the virus.
That's
and
right.
what are we seeing this week?
So, Dennis, it's still all Delta.
Right.
And I think this is very good, that no other strain has surfaced in New York State or capital region, and for that matter in the country. There's a red line on this graph as well that overlies the bars,
Right.
and that's the total number of positive cases,
Right.
and that's going down.
That's the yellow one. You can see that
It's
going
a yellow?
down. Yeah.
Okay, I thought it was red.
Okay.
Okay.
Well, it's the one that's going up, and then it comes right back down.
That's right.
Very
That's
good.
right.
Fred, do you believe that the vaccine rolling out and the people taking the vaccine has slowed down the ability for that virus to mutate into other forms? Is there some belief that that's happening?
Certainly, Dennis, I believe that.
Yeah.
If the virus isn't infecting more and more people,
Right.
the ability or the opportunity, if you will,
Right.
for the virus to mutate shrinks, right?
They say
So
if it
logically,
can't replicate,
it can't mutate.
Right.
Exactly.
Very good. So that's that graph there, so thank you for that. Fred, a couple more things on the vaccine front that have been in the news. Let's start with the one about the court ruling related to religious exemptions. What's the status of that?
So, Dennis, the Second Circuit Court on Friday ruled against those that were not in favor of the vaccine mandate because of no ability to have a religious exemption. So there were 2 cases. There was actually an injunction that was issued by a lower court. So that injunction was lifted, allowing now the state to enforce the vaccine mandate without a religious exemption.
But for those that are currently working on this campus or other area hospitals who have submitted and have been granted a religious exemption pending the court ruling, any change today?
No. So this was a verbal ruling. They lifted the injunction. They're going to issue a written opinion, which perhaps comes later this week or next. And then we're expecting that the state will say something about that, and then we would act at that point.
Okay. So no change today, although let me just walk us down this path. If in fact we get to the point where the state says religious exemptions are not allowed, those individuals who have sought one would then have the decision and choice if they want to get vaccinated or not.
That's right, Dennis.
All right, so they-
and we'll work with them.
Right.
We'll try to help them through that decision,
Okay.
and from my perspective, make the right decision, which is
Okay.
to get vaccinated.
Okay.
And we'll probably give them a little period of time to work through that as well.
Very good. Also on the vaccine news is pediatric vaccines. We are, of course, are talking about the approval
Right.
of Pfizer,
By the CDC.
ages of the CDC, ages 5 to 11, and it's happening.
It is, and Pfizer was ready to ship, and the vaccine has actually arrived. And Dennis, we've inoculated the first children here at the medical center today.
Which is fabulous.
Yep.
So it's happening in the region. I was looking on some websites today, local pharmacies that have scheduling appointments. You can go there. You can certainly schedule your appointment. We know that some of the schools are going to be offering it in the
Yes,
school, and the
that's
county
right.
health departments are participating in that. If you have any questions, let's remind ourselves of the website that we were so dependent upon for so long, capitalregionvax.org. You can go there and look up any information.
And for parents, Dennis, this is really important.
Right.
The CDC and the FDA looked at a lot of data. Clearly, the risk-benefit here is so far in favor of getting the vaccine
All right, very
for
good.
children. And it's as much about them not transmitting to other vulnerable people as it is about keeping them safe.
Right. Somebody said to me the other day, they said, why would I vaccinate my child against COVID when the likelihood of them getting COVID is so small? And I said, well, we vaccinate children against polio, and we vaccinate children against a lot of diseases that are very rare in that age group, but yet we believe that it actually helps the health of the whole population.
Keeps those illnesses
Right.
at bay.
Very good.
Absolutely.
So speaking of which, and then we can move on, flu, we know on this campus, flu vaccines, we have an internal deadline set for, I believe it's next week.
Next, I think it's Wednesday, Dennis, the 10th.
And we know a lot of people may have gotten that vaccine at locations other than this campus. There's a very easy way for you to load that information into the system. I think it's called the Quick system.
That's right.
And those instructions are on the intranet. But if you have any questions, talk to your manager, reach out to Employee Health Service. We'll help you.
And Dennis, it's important. The flu actually has started to surface
Right.
around the country. We heard about an outbreak in Rhode Island, at a college in Rhode Island. So we're going to have a flu season, I think, this year. So please get vaccinated.
Very good, very good. Okay, Fred, we have a lot of top doctors here.
We do.
We have a lot of top nurses. We have a lot of top everybody's. But CDPHP has a list they put out annually, and it's called the People's Choice Top Doc, and one of our own has been recognized.
And that's Robin Tassinari.
Right.
Robin's one of our psychiatrists. If you don't know him, I can't imagine you don't know Robin.
Right.
He's such a fixture here at the medical center.
Right.
He's a fantastic person, a fantastic doc, a fantastic psychiatrist.
I agree.
Really a great person.
He is a great person, and we congratulate you, Dr. Tassinari,
Congratulations.
and we certainly think that's well deserved. In addition to that, a couple of our primary care clinics have been considered top practices.
That's right, Dennis. So our community general pediatric site, which is the Great Oaks facility, was listed among those top primary care providers, and the medicine pediatric practice out in Latham. So two of our own here, the family here at the medical center, and then actually, Dennis, there were a couple both at CMH
Yes.
and Saratoga Hospital. So across the whole system,
Albany Med Health System.
Yeah, we have a number of top primary care practices.
Keeping on the theme of top individuals, we have another Daisy Award winner, and this is a nurse from D4 East. This is John Van Garderen. And D4 East is our unit which deals with oncology. It's a cancer unit, a very special unit. And John was recognized, and Fred, as always, has a wonderful quote from somebody.
This one really gets you. So here's the quote. It doesn't really sink in until they're setting you up for chemo that you really have cancer. It was John who made this realization easier with his positive attitude, professionalism, and dedication to patient care. John acted like my armor to enter the fight, and I cannot thank him enough. John continued to inquire about my condition while my wife was visiting and routinely stopped in my room just to say hello, reflecting the compassion shown by healthcare workers. Congratulations, John. Just an absolutely fantastic approach to patient care. You made a huge difference, not only in care, but in the compassion you demonstrated for this patient.
Yeah, that's special.
Very much.
That's special. Way to go, John. That's fantastic. Congratulations. Well deserved. If you have not had a chance to see our most recent video, Inside Albany Med, we have a great one, and I was privileged to talk to Angela Mextorf, and this was a surgical ICU nurse that I think we all know.
Yeah.
And she's been here working in the surgical ICU, just a fabulous nurse. She had some great insight into what it means not only to work there, the types of patients she cares for, mentoring of young nurses, why she stays here. It's a great one, so check it
Good.
out.
Check it
Very
out.
good. Fred, our favorite topic, blood drive next week.
Blood drive next week.
So what's the information?
Next Thursday, the 11th, from 7 in the morning until 3. You know, Dennis, we're still in a blood shortage nationally, so it's really important.
Yep.
Please think about it, sign up, donate blood.
The need is great, and one thing which I like to use is that Rapid Pass.
Yep.
You can download the app, you can schedule, you can fill out the information ahead of time.
You can schedule on it
Good,
as well, because
good.
I scheduled my 7
Good.
a.m. donation.
Good. And then you can pre-load the information so you can move
That's
through the
right.
line quickly and get back to work. So
That's right.
We will be there. We will see you there. Deadline coming up on open enrollment. I think we only have about 1 more week, maybe 8 more days.
That's right, 8 more days.
Get your information in for open enrollment.
Yep.
That's a big stack.
Yeah, we covered a lot. Yeah.
Did you ever watch the Actors Studio with James Lipton?
Actually, no.
He would always he would interview actors, and at the end he'd be like, you know, if you could be a type of fruit, what would you be, or something like that. So I'll have to think of a question.
A type of
I don't know.
fruit.
He would always ask these bizarre questions.
Okay. An avocado.
There you go. Very good. And it's daylight savings this weekend.
That's right.
So that's Sunday
Fall
night.
back.
Spring ahead.
Fall back.
All right. To those who are working here this weekend, as always, more than ever, we truly appreciate it that you're here. And we'll be back again next week with some more information. Very good.
Very good.
We ask that you once again, please take care of yourself, take care of each other, and we'll see you next week.